Welcome everyone. This is this evening's Portland Clinic live chat, and our theme tonight is less stress and more happy, and that is something that we can all agree with and something that we probably all want more of in our lives. So our guest tonight is Dr. Pat Blumenthal. She's the clinical psychologist and director of behavioral health at the Portland Clinic. So we're going to be talking about reducing stress. We're going to be giving you some practical tips and some resources to watch out for on the Portland Clinic's Facebook page. So welcome, Pat.
Hey, thanks for having me.
So we're generally talking about mental health concerns, and tell me what that landscape is. What is considered to be a mental health concern?
Well, it's a good question because I think typically people have thought about mental health as mental illness, and it's a fact that 1 in 5 Americans suffer from a mental illness, which is a pretty staggering statistic. But that only captures people who have been identified and diagnosed with a mental illness, and really mental health captures much more than just mental illness. It captures people struggling with stress, struggling with transitions in life, a whole host of different issues that people will come into.
We recently talked about mental health concerns being a pattern of different things. Can you talk a little bit about that?
Yeah, when we look at mental health, like what is mental health? We know what our physical health is, but mental health is really made up of different areas. So we're always concerned with emotional, social, cognitive, and spiritual different areas of your health. And so we want to know, what are you feeling? What are you thinking about? How are you behaving? How are you relating to other people? And in those different areas, we can see patterns of what our typical personality is like. So for any one particular person, whatever their normal behavior is, they have certain ways that they are in the world. And we can identify problem behaviors when we see any kind of change in any of those particular areas of their life.
So we're starting to get into what are the warning signs.
Mm-hmm.
Changes in normal behavior, changes in things that one would normally experience. Mm-hmm. So can we get a little bit more specific there?
Mm-hmm. Sure. Because any of the problems that we typically see, depression, anxiety, difficulty sleeping, those are all very common things, right? And it doesn't necessarily mean that there is a problem per se. But sometimes when some of those issues start to linger longer, or they become a habit over time, then we kind of want to pay attention to them. Some of the things that we look for are people beginning to isolate. Are they not getting out of the house? Are they not wanting to participate in their usual activities? Are they sleeping too much, sleeping too little, their appetite changing, are they just not making it into work, are they using substances? These are all the kinds of things that we would look at as maybe being indicators that something's wrong.
That's a really good list for observing those changes in others. What
Mm-hmm.
about observing those changes in yourself? What are some of the
Mm-hmm.
warning signs that people should watch for
Mm-hmm.
introspectively?
Yeah, that's a great question, because sometimes, especially for introverts, they spend a lot of time in their own head, and they can sometimes lose track of whether or not they're functioning as optimally as they could, right? So sometimes they have to check in with other people and hear what other people are getting, kind of feedback they're getting from others. So if they're hearing, gee, you're not going out with us anymore, or I notice that you go to bed early and you don't want to get up in the morning, or things like that. So you do have to sort of listen to input from other people. But also, just on our own, we can acknowledge when are we having disturbing thoughts about things? Are there worries or anxieties that we notice that we've really been clinging to that are a little bit more out of the ordinary? And things like that. I think those are sort of warning signs to ourselves that say, maybe we should check in with somebody.
Is it a warning sign when those patterns are happening to the point of impairment? Is that really a red flag for you?
Oh, absolutely, yeah. Because you can have those symptoms and still, go about your day. You can still go to work. You can still, take your kids to school and all of those things. But if they're interfering with your ability to perform your tasks in life, whether it's going to work or taking care of your family or anything, or taking care of yourself for that matter, then you know that it has kind of moved beyond the normal kind of stresses or problems that we have. But that's not to say you can't seek help, if you're not having any functional impairments in your life. I mean, certainly when you've crossed that boundary, I think that's more imperative.
Mm-hmm. So when you're feeling like, maybe I should talk to someone, or maybe there is actual impairment and I need to get help, what are some of those first steps to get assistance?
Well, the first thing I would recommend is if you haven't had a physical in the last year, you should definitely see your doctor and have a complete physical, because sometimes there are issues that you may be experiencing as mental health issues that are really part of a medical problem. For example, thyroid issues. If you have hypothyroid problems, then you could very well have depression and difficulty getting out of bed. If you have hyperthyroid, you could have anxiety issues and restlessness and agitation. So we want to see if there are any underlying medical issues. Diabetes is another one, vitamin D deficiency. So there are things that your medical doctor can first screen for. Then when you've gotten a clean bill of health, or you're a healthy person and you're still having mental health issues, then you should definitely think about seeking outside help. A counselor. There are, in Portland, there are thousands of mental health therapists that are available and have very different, all kinds of specialties. So you can do some, your own digging around and Googling and figuring out who you might want to see, or you can ask your doctor at the Portland Clinic. You can talk to your doctor and they can give you recommendations. We have our own behavioral health providers at the Portland Clinic as well to help, so we can certainly assist in that way. And then, medication is another option for people. It's not something we necessarily push, but it is an option for people who are suffering.
Mm-hmm. So treatment options, there's really a spectrum.
Mm-hmm.
And is it up to the primary care physician to sort of help people figure out where they are on the spectrum? Is that sort of the first stop?
It can be. The primary care physician can help, certainly. Sometimes, a patient might come in to see a doctor and not know that they're struggling with anxiety, and they may have come in for sore throat or something else, right? So I really would encourage people to bring up those kinds of issues because they matter. They're part of your whole health, right? And so if you're struggling with anxiety or depression, it's going to affect your whole body. So bring it up with your doctor once they know, and we have other ways of screening people too at the Portland Clinic to help identify people who are at risk for depression. Then they can help kind of, guide you to a treatment option that's right for you. And certainly if you want to do it on your own, you don't have to go through your doctor.
Mm-hmm. Can you talk about those screening options a little bit? Because I'm a patient at the Portland Clinic, and I recently went to see my doctor just for my annual visit, and I got a questionnaire that just had a couple of questions. They were very simple questions, but they really did cause me to think about those patterns. Was I feeling isolated? Was I having difficulty motivating myself to do my normal tasks? So I just had that moment of pause to think about it, and I assume that's part of the screening. So can you talk a little bit more about that?
Yeah, exactly. There's a big push in the country, and we're certainly behind it as well, to really identify people with mental health issues when they come into primary care. And so the screening tool that you got was the PHQ-9, which is a fancy word for depression screening tool. And the questions that you were asked were very simple ones. They're asking you basically in the past 2 weeks if you'd had trouble sleeping, or were you restless or fidgety, were you having trouble getting out of bed, and thoughts of suicide. I mean, so we really are looking to try to identify people who are having those problems, who may be kind of shy about bringing them up, or maybe even haven't thought about their own issues in that light. So I'm glad that you got that screening tool.
Yes, and it did give me that moment of pause just to think about it and think about how I was feeling at that moment and what patterns there might be. So I appreciated it. It was just good for my own self-awareness.
It's good. I think it does help people to pay attention to that, because I think for a long time mental health has really been treated as sort of, a side issue, right? We'll send you off to see somebody. Really, we don't want to have to, get into that area. But now we're really looking at integrating mental health and behavioral health into the primary care setting so that your whole body is being treated, including your mind.
And I think that takes a little bit of the stigma away too, because many of us may feel more comfortable going to that annual doctor's appointment. And I think in our society there is still a little bit of stigma attached to things like depression and anxiety. And yet they're real issues that many people have to work through.
Right.
You know.
Unfortunately, yeah. I think it depends on parts of the country that you're from. I mean, in some parts of the country, like in New York and Boston, having a therapist is a very common thing, right? It's actually everybody wants to have one, right? But in other areas, people are a little funny about seeking help for those issues. And one of the things that we're trying to do is to normalize it and see it as a normal, behavioral health is a specialty just like dermatology and all the other specialties that we have. And we have behavioral health providers at the Portland Clinic, so you could see a psychologist at the Portland Clinic and, treat it just like you would your doctor's visit to see your primary care.
I'd like to move a little bit into the topic of stress management. And you shared earlier that 1 in 5 people in the country have mental health concerns. I think maybe more than 1 in 5 people might say that they're stressed out at any given time.
Right.
That's really a very common thing.
Mm-hmm.
And I'm sure that you see a lot of people who come in and complain of stress or say they're feeling really stressed out. So how do you approach that when that's the main complaint?
Yeah, well, stress is a normal part of life, right? So we're all feeling that at any time. And I can't think of any patient that's ever come in to say that they've had no stress at all. But I think that the typical stressors that people are dealing with personally are often in their home life, whether they're having conflict with their partners or they're having job stress and they're working too many hours and not enough time with their loved ones. Parenting concerns, raising a family today is tough, and so a lot of that stress, it starts to build up after a while, and it can take a toll on people. So it's not unusual for people to kind of come in with the first thing that they tell me is that I'm really stressed out. I'm having trouble with this. And then as we kind of talk a little bit more, we see how it's impacting their life. They're developing other symptoms. They're not their normal selves.
So we're going to pause for a moment, and we have a question from the audience. So Amelia asks us, is there such a thing as quote-unquote good stress?
Yeah, I think there is. Yes, absolutely. Because basically everything is stress, and because we're not static people. We live in a world that's constantly changing and fluid, and so we're always running into something, whether it's a traffic jam, which is bad stress, but there's good stress like having a baby and buying a new home and getting a new job, or anything that's going to add hopefully happiness and joy and value to your life. Initially, when that happens, there requires a lot of change and transition. So in those particular instances, I would call those good stress. But they do take a toll. You do have to still kind of pay attention to how that stress is affecting you, even though the outcomes hopefully are good.
Yes, it does take a toll. A coworker recently shared stress around getting married, and the bride got hives. So getting married is a very good thing, but yet it had this physical manifestation that was a little painful and uncomfortable.
Yeah, hives is a perfect example of the way our mind and body are connected, right? So it's usually a stress-related issue, and it comes on right at the time when you don't want it to happen, right? And typically resolves right after the stress is over. And so that can be really, annoying to somebody. But perhaps, in the future, if they know that they're sort of predisposed to having hives in stressful situations, they can do some things to alleviate their stress ahead of time, so that it won't be as bad.
Let's talk about some tips for stress management. So what are the common pieces of advice that you give?
Well, there are a lot of things that people can do to decrease their stress. Things such as listening to music, meditating, and going out into nature and taking walks around the trees. There's a lot of research that supports the fact that people who live around trees or spend time outdoors actually have lower levels of depression and anxiety. So we're lucky we live in Portland, where we have a forest right in our city limits. So we can take advantage of that, and we can get out there, and people who get out at least once a week, and whether it's going to Forest Park or Mount Tabor, or if it's just sitting in your backyard under a tree, even if you can't get out, walk or hike, that will have value, and that will help de-stress. Yoga is another really, a lot of people do yoga, and that's great. And for those who don't, you should do it because it has great health benefits and it decreases your stress levels. And then just on a more like daily basis, people can, do breathing exercises. They can, just take a few moments out of their time each day to just focus inward and get, a little more calm.
For those of you who just joined us, we're talking about less stress and more happy, which is a topic that we can all agree with. And we're joined by Dr. Pat Blumenthal, the clinical psychologist and director of behavioral health at the Portland Clinic. And we're just about to go into some very practical tips that you can do every day to reduce your stress. So Pat, you had just talked about a breathing exercise, so let's try one and let's demonstrate for everyone something really, really simple that we can all do every day to sort of reconnect and bring that stress level down, which is what we want.
Right. And breathing, I mean, when I tell people, you should practice breathing, everyone sort of rolls their eyes because, I'm breathing all the time, right? But the problem is that a lot of times we're not breathing correctly, or we're breathing in such a way that it's such a shallow breath that no wonder we're sort of starting to get tired and fatigued and a little foggy, right? So taking a moment out of your day to just get, seated with your back straight, and you want to put your hands on your lower tummy. And the point of this in terms of breathing is that you want to make sure that when you inhale to a slow count of 4, that you're also pushing your belly out as you're doing it, like a balloon. And the idea of that is that you're creating more room in your lungs to take in more air. So you're getting a more cleansing breath.
More oxygen.
Right.
In your body.
You're waking your mind, right? And then you just slowly exhale, usually to a count of 4. And you just repeat that. So we can try it right now if you want.
Yeah,
all right.
Please.
Okay, so hands on the tummy, and then inhale. And as we're going to inhale, you're going to push your belly out. Ready? And belly back in. So I don't know if people can't see that, but you probably can feel your tummy pushing out. And when you're doing that, you can feel your lungs actually bringing in more breath and expanding.
That's great. And I'd like to close my eyes too, because I feel like I do breathing exercises a lot. It sort of just takes me out of my moment or whatever I might be focusing on that is stressing me out.
Yeah. It feels clearer right in the moment. People are always kind of surprised that they can get a little boost in their day just by doing something that simple.
And it oxygenates the brain, and it brings oxygen into your muscles.
Exactly.
Yeah. I'm a big fan of breathing. Big fan of breathing. And sleep and other wonderful things that help you with your stress management. There are some resources that are coming from the Portland Clinic, and I just want to take a moment to show this beautiful coloring sheet from local artists who were commissioned by the Portland Clinic to create a Portland-themed coloring sheet. And if you can't see it in detail, this one is a beautiful coffee mug, and it has Mount Hood and roses and a donut. No calories here. And then there are 2 others that were produced by artists, a running shoe. And what's so charming about this one is it has that beloved design from PDX Airport on the shoe, and a salmon with waterfall in the gorge and wonderful trees that will help you reduce your stress. And these aren't colored yet because they're hot off the presses. So keep an eye on the Portland Clinic Facebook page and definitely check back, because these are going to be available soon for you to download and color at home and have less stress and more happy.
Yeah.
So we're very
Coloring
excited.
It's a great stress reducing activity.
Yeah, so please watch for those Color Portland free coloring sheets that are coming soon to the Facebook page. So let's move on and talk about something that is a little bit more serious than everyday stress, and that is panic attacks. And this is something that affects a lot of people.
It does, yeah.
And really can affect them adversely and take them out of their game when they're in a situation of having a panic attack. So can you talk about what those symptoms are so we can better recognize them?
Sure, yeah. I mean, panic attacks are so common, and anxiety disorders in general. It's actually the number 1 reason that people seek mental health treatment is for anxiety disorders. And so panic attacks are pretty frequent, and sometimes people know that they're having them, and sometimes they don't. The first time you have one, you're probably not sure what's going on, and after you have your first one, I think people pretty much know. But initially what happens is that you have this very sudden gripping fear that comes out of nowhere, and it starts to tell your body that you're in danger, and so you have an increased heart rate, increased respirations, you begin to sweat, you might get tingling in your hands, chest pain. It can feel like a heart attack, and that's why many people, the first time they have a panic attack, end up in the emergency rooms just to make sure that they're not having a heart attack. And so once people sort of are cleared medically and realize what that is, then they're sort of always, waiting and seeing if that something that may happen again. And that's the thing about panic, is that when you have one attack, it always sort of makes you worry about when you're going to have it again, because they come out of nowhere. You don't know where you're going to be. Fortunately, anxiety disorders and panic attacks are very easily treatable disorders. We can, work on them in therapy. Usually just a few sessions will help somebody gain mastery over a panic attack. And there are some different kinds of, exercises that people can do on the spot if they need to.
Yes, because it may be that someone's having a panic attack and they're not in the therapy session, or they're not with their healthcare provider or their therapist. So if someone's driving, if someone is in a meeting or at the office and they're having this panic attack, what's a good exercise that you recommend?
Yeah, it's pretty common for people to have panic attacks if they're out on the freeway or going over a bridge. Those are two common places. And typically what I coach people to do is that you want to do something that's pretty immediate and quick and easy to remember. You don't want some complicated set of directions, right, to get you through. So the best one, which is a really grounding exercise, it just brings you right into the moment, is a combination of breathing and counting. So what you would do is that once you felt it coming on, you would start to do your deep breathing, just as I had showed you. So taking deep inhales and exhales. And as you're exhaling, you start counting backwards from 100. So you breathe in and then out, 100. And then breathe in, 99, and so forth. And you aren't probably going to get down to 1. That would be a really long panic attack, because panic attacks don't typically last all that long, even though they feel like they're lasting forever, but they don't. And you're really kind of riding that crest of the panic, and then it will recede. And by counting and breathing, you're really kind of getting yourself, back in the moment, getting your mind concentrating on something easy, and getting your breathing regulated again. And that usually works very successfully for people.
Is a panic attack the equivalent of a fight or flight response? All of a sudden your brain and your body and your emotions go into that state?
Yeah, exactly right. It's just a part of our brain left over, that just alerts us to some danger that really isn't there, but our body reacts as if it is. And so, if we have to do manual override on those instead of letting our body go into autopilot mode on those.
I like the manual override.
Yeah.
About how long do panic attacks last?
Oh, they can just last for a few minutes at the most. I mean, some people will say that they've had panic attacks that have lasted, 20 minutes or an hour. Those are rare, and sometimes, that I'm not saying that they can't happen, but it can feel that long. I mean, that's the experience of having a panic attack is so dreadful that that it's almost hard to kind of put an end point on it. The important piece of that is just being able to kind of, get it before it gets too hard, too high. You want to kind of bring the panic down.
Yes, and have some self-awareness of, okay, this is what's happening to me.
Exactly.
And I can do my breathing exercise and get through it.
Mm-hmm.
The breathing exercise reminds me a lot of some meditation apps that I have experienced and that I like. Mm-hmm. And there are some counting backwards exercises that have a similar intention to sort of take the mind off I call it the newsreel, that just might be going on in your mind as you're trying to sleep, and just get you off that track and get ready to go to sleep. So let's talk about sleep a little bit, because that's so important for mental health and for overall wellness. So how important is sleep?
It's huge. It's huge. It's sleep hygiene is really an important thing for people to think about. It's as important as all the other things that we take care of with our body. We eat balanced meals, we get exercise, and we should be really serious about the kind of quality sleep that we get each night. So, and that's a real problem for many people. They'll say, I'll ask patients, well, how many hours of sleep are you getting at night? oh, 5 or 6, that's all I need. And yet they've come in with maybe anxiety, depression, and problems focusing. And so if we kind of work on trying to tweak that and get better quality sleep, sure enough that there's a rebound effect on that in terms of getting getting the depression down, the anxiety down. People, I think, they underestimate how much effort needs to go into getting good quality sleep. They think, just go up to bed, just jump in, and that'll be it, right? And it doesn't happen. Some people, that's great, not all. But people need to do things, set up a good routine at night. They need to, cool their room off. They need to power down all of their electronics. They need to do all of their kind of normal routines. If you know that you need 8 hours of sleep and you need to get up at 7 o'clock in the morning, you need to be falling asleep at 11. Not going up to bed at 11, but falling asleep. So then you really have to kind of back that off a little bit and build time in for your routine so that you can, by the time you're, getting into bed, you are going to get that full 8 hours.
We have another question.
Okay.
So Susan asks, if I have questions about mental wellness, who should I talk to first? My doctor?
You can. There are no rules around who you can talk to first. If you're, you might want to talk to a loved one first and share your concerns about what's going on. Sometimes having that support is really helpful. But if you can't, for whatever reason, you can ask your primary care doctor. You can also just directly contact a mental health therapist in the community. There's lots of ways to find therapists now on the internet. Most therapists have their own website, so you can kind of get a sense of what their practice is like and if they'd be a good fit for you. But by all means, go out and meet with somebody and just see if it works. See if they're somebody that you can work with.
It sounds like the important thing is to talk to someone and someone
Mm-hmm.
that you feel very comfortable with.
Mm-hmm. Absolutely.
And I love the suggestion around starting with your loved ones because they might have great suggestions too.
Mm-hmm.
And they care about you the most.
Yeah, right. And some of that stress kind of starts to fade when you know that you have support.
So let's wrap up by talking about a couple of concepts. Can you relate mental health concerns to overall wellness of the whole person? So from your perspective as a director of behavioral health, how do you see those two concepts relating?
Well, I'm a little biased because I'm a psychologist, right? So I see everything through the lens of how mental health affects people. And I think that there's been a great push in this country and in Portland and at the Portland Clinic around looking at the person more holistically. And that means that, your mental health matters just as much as your physical health. And there are so many studies coming out nowadays showing that, the relationship between the two, that people who have chronic illnesses, for example, like diabetes, chronic pain, also have mental health issues. And that if we don't treat the mental health issues, then the disease processes, the illnesses that you're being treated for are not likely to improve unless you get help for the other issues. So they really go hand in hand. And looking at when you're taking care of your physical health and you're concerned about that, you should also check in and be concerned about your mental health too.
That's great advice. And as we close here, tell us more about the resources that are available at the Portland Clinic.
Well, at the Portland Clinic, we have 3 psychologists working at 3 separate branches, and they are available to Portland Clinic patients. Typically, the primary care doctor will refer you in to see one of us if that's what you choose. If you don't want to see one of us, we certainly can refer you to people in the community. And there's also, other treatment options too. Doctors can talk to you about medication. They can talk to you about support groups. They can talk to you about acupuncture, massage therapy. So there are a lot of resources out there, and there's no one kind of treatment that's going to be for every person. So you're unique. You should talk to your doctor about your unique needs.
Thank you, Pat. And thank you, everyone, for joining us today.
Thanks.
Remember to breathe deeply and go for a walk in the beautiful trees and forests that we have here in Portland. It will reduce your stress, and you will have more happy. Thank you.
Thanks. That was fun.
Yes.